Tammy Baldwin.
Thank you, Madam Chair. Welcome, Mr. Secretary.
Thank you.
As we've discussed, I've been working with Wisconsin veterans who raised concerns about the quality of the compensation and pension exams that they receive for traumatic brain injury and other neurological disorders. Although the VA considers these exams administrative rather than clinical, I learned from these veterans that an erroneous negative opinion not only impacts disability claim decisions, it can have substantial impacts on the veteran's mental health or the likelihood that they will seek additional medical care for the condition that they have been incorrectly told that they do not have. What is the VA doing to improve the compensation and pension exam process and achieving better oversight of this critical part of the disability claims process?
Yeah, thank you, Senator. Obviously, this is a significant concern, as I've characterized to you in private setting as well. And we see this as a challenge and hear from veterans that this is a challenge, including, although we're making good progress on this, in cases of military sexual trauma. Mm-hmm. Same thing where a veteran is denied, probably unjustifiably, and that has not insignificant mental health impacts as well as knock-on health impacts. We and our acting Undersecretary Josh Jacobs has taken this issue on very aggressively. We are building incentives and disincentives into our CNP exam contracts. This is a function that is overwhelmingly carried out by contractors, although that was not the case in TOMA. So we're trying to increase we are actively increasing our oversight of the conduct of the exams, and then we're building in quality metrics, incentives to increase quality, and then disincentives, obviously, to disincent what are obviously shoddily carried out CMP exams. This is a perennial challenge for us, and we'll stay on top of it.
Thank you. Secretary McDonough, I want to thank you for your strong support in the budget for the Jason Simkoski Memorial and Promise Act. This law continues to hold the VA accountable and strengthens oversight of provider opioid prescribing practices and provides safer care for our veterans. There have been significant improvements in the VA since Jason's law was first implemented, but there's still work that needs to be done. I would ask for your commitment to briefing my staff on how the VA is enforcing compliance and accountability for providers when prescribing opioids, and I might note the measure also looks at the interaction between opioid prescribing and benzodiazepines. But I'd ask that you update my staff on that compliance and the progress that we're making since that law was passed.
You have my commitment.
Thank you. And my last area is to note that I was pleased to see strong support in your budget for community-based suicide prevention efforts. In addition to our great veteran service organizations, county and tribal veteran service officers play a crucial role in ensuring that our veterans receive the benefits and care that they deserve. A modest 1,700 accredited service officers nationwide are actually responsible for processing more than $42 billion in claims annually. Those veterans service officers at the county and tribal level are basically funded locally. And so my bipartisan bill, the Commitment to Veterans Support and Outreach Act, would authorize the VA to provide grants for county and tribal VSOs to better support our nation's veterans. And I'm hopeful that the Senate is on track to pass this legislation this week or next. Would you support the additional resources and support to county and tribal veteran service officers authorized in my bill?
We have made it a priority to support and tighten the partnership with county VSOs, and we have, for the first time ever, dramatically expanded the authorization of new tribal VSOs. We did that first in New Mexico with Senator Heinrich. We're doing it now in Alaska. And so we're all for this. I think in the past, we've had our support for your bill contingent on getting additional resources to help us pay for it. It's a little bit embarrassing to acknowledge that in a budget this big that we don't see the overhead to cover it, but we think it's important. We'll find the money we'd like to make sure that it comes with money to fund the authorizations. But in all cases, these are really important partners to us, and we're looking for ways to increase that partnership.
Thank you.
Senator Hoeven.
Thank you, Madam Chair. Secretary, thanks for being here this morning. Appreciate it. Appreciate your